Yeah, I think the story is told in what we're seeing in terms of people who are the numbers of cases, the numbers of people in hospital. It tells me that people are doing what we've asked them to do. And no more time is it important to do that than this weekend. We can watch what's happening around us, and I think that's a really important thing. We are, as I've said, we seem to be holding our own, and I believe that's because people in British Columbia are doing what we ask them to do. We also have some data that's come from a couple of big data sources that show that we can measure that, and that people aren't going out and about, as I say, as much as they were prior to our recommendations. And we just need people to hold this line. You do need to hold this line because we need to keep our communities safe and our families safe here in BC.
Next question is from Tanya Fletcher, CBC.
Hi there. I'm wondering if, on that note, looking at regions outside the Lower Mainland that are reporting 0 or single-digit cases now daily, would there ever be a day the province would consider perhaps relaxing or tailoring rules, perhaps depending on what's happening locally by jurisdiction that way?
Absolutely. We're looking at all kinds of options of things. And as you say, the outbreak and the pandemic is different across the country and across the province. We're a very large province with quite different demographics and different geographic issues. So yes, in many places where there's single introductions, for example, although I will say that right now we have community transmission in most areas of the province. So it's a bit challenging. And we also know that people have come back from traveling to many areas of the province. So we need to measure that as well. But we are looking at what can we do to try and relax some of the issues or to increase some of the, for example, the healthcare needs and address those in a safe way in different parts of the province. And we will be tailoring it as best we can to what's happening in the different areas that we know of. And part of that we'll talk about later next week when we look at some of the modeling, but that thinking is going on now for sure.
Jeff Andreas, Radio NL.
I just had a question in regards to staffing at long-term care homes. You have talked repeatedly about the need to have one person working only at one home, and from your comments earlier, it sounds like that still isn't 100% happening. Why is it taking so long to get that in order? I understand logistics are probably complicated, but it seems pretty important for these individuals who are dealing with our most vulnerable.
Yeah, it is exactly that. It's complicated. There are many different agreements. There's private and public organizations, and it was really a matter of understanding where the problem was, or the problem where people were, how many were working at different areas, and not only is it particularly in the Lower Mainland, the volume of long-term care homes and people who are working at them. But they also work sometimes in home care or as paramedics or in acute care. So being able to pull all that data together was one of the first steps that we did, and that happened over the last couple of weeks. And to understand people's preferences was another part of it. So yes, there's a lot of negotiation. What we didn't want is for things to happen so that people only went to one or two places, and there were people who were left without staff, or care homes that were left without staff. And that is the really important thing. So we have focused it, focusing on the areas, the long-term care homes where there are outbreaks already, and have stopped the movement of staff from those facilities. And it's going broader now, and I don't know if you want to talk to that as well.
Just say that this involves directly, right now we think, Jeff, 4,200 workers who will effectively have where they're working change in this period. We had to consult with 20,000 workers, and some health authorities, this has happened more quickly than others, but it is, of course, an exceptional change. And I wanted to express my appreciation to all those involved, including those who are care providers, who own care homes where there are public long-term care beds. But this involves everybody. It involves care homes that don't have any public beds, for-profit and non-profit care homes with public beds, and health authority owned and operated beds. So it involves a very significant workforce and a huge challenge in that workforce, consulting effectively, consulting with 20,000 people, identifying people affected and then making the change and putting first in all of this the residents. Because if everyone were to decide to, who are working in 2 care homes, were to decide to work in one or to move over to work in one, that would obviously negatively affect care. So at the heart of this is protecting the residents, as well protecting the workers who are doing extraordinary work. We cheer for them every day, and we should. We should celebrate them every day during at times of pandemic, and every other day as well. They do extraordinary things. So there is a lot involved. I think in the workers in question, probably 50 to 60 different collective agreements, for example. So there's a lot of complexity, but what we've seen is real determination on the part of everyone, from the HEU and the BCGEU and the BCNU on the one hand, to all of the care providers on the other, and the health authorities and everyone involved. So it's been a complicated thing, a lot of moving pieces, but I think we're doing the right thing for workers and the right thing for residents.
Next question is from Shrishti Gangda, CKNW.
Hi, Dr. Henry. Thank you so much for taking my question. I just have a question about work sites and mining sites and things like that. You've obviously said a number of times, don't go to small towns, don't go to remote communities. They might not have the resources to deal with an outbreak on their own. I've been contacted by someone who lives in Princeton, which ostensibly has no confirmed cases of COVID-19. He's concerned that the Copper Mountain mine is bringing in about 150 workers next week for mill maintenance. And he's concerned that, an influx of people from all over BC and Alberta will potentially bring COVID-19 into the community. So for, work sites that are adjacent or in small communities, are there increased precautions that you've been telling those companies to take?
Absolutely, and this is something that we've been dealing with for a number of weeks. We do have guidelines that have gone out, but also working with the health authorities in the regions. So you can't, as I've said several times, you can't let a mine abandon it, for example. So we do need to have workers in there for safety. There is some things that need to happen on an ongoing basis, but how they do that and how people are housed and how people are, their work that they do is spaced appropriately, that we have the appropriate precautions in place, that people are being monitored, that there's a connection with health services in the facilities. All of that has been directed from my office to make sure that we're doing what we can to make sure that if anybody is identified with COVID, that they're able to be cared for either on site or that we have a plan for how that will be managed. So yes, there are some very detailed plans for all of the industrial sites around the province that this is affecting.
Penny Dufflo, CTV.
Oh, hi there. Thanks very much for taking my question. Now that Dr. Tam has presented modeling and been really transparent about what they're looking at for infections and a death toll nationally, will you give us the numbers that you've been working with for BC?
We've already given you the numbers we're working with BC. Our modeling has been slightly different in that I don't feel there's value in some types of the projections that have been presented. Our modeling is about what do we need to prepare for. And as you can see, the deaths are not something that can be predicted. It depends on how your outbreak evolves. And so we'll be continuing to use the modeling. We use some much that is very similar to what they have in what they presented this morning, and as a matter of fact, we've contributed to much of the modeling and the data that they're using. So we will continue to present, and we publish the ongoing epidemiologic curve and the case counts and our test positive rates every day on the BC CDC website, and we'll be presenting more of our dynamic modeling next week as well.
I want to assure you I'm not adding anything on the questioning of modeling to what Dr. Henry has said, just to say that we're expecting on to present an update to the modeling we provided next Friday, probably Friday morning, so you can plan for that. As you know, BC was the first province to provide its modeling 2 weeks ago, and now others have followed, and we're going to update that modeling so people can see both how we're doing and what our expectations are on next Friday.
Vaughn Palmer, go ahead.
Yeah, I wanted to ask a follow-up on that one because now that we have the national numbers projecting deaths, I assume that British Columbia was involved in producing the national modeling as well. Most other provinces have done that, and as I understand Dr. Tam's reason for doing that, it is to provide the public with a sense of how things could play out if we exercise and follow through on stronger controls, and what could happen if we sort of slacken our guard. Can you explain why that doesn't strike you as something that might be helpful out here, or whether or not you might change and incorporate the cumulative deaths the next time you do modeling here?
Yeah. So those are not projected deaths. This is the challenge. Those are models. So they're a range of possibilities of what could happen. It's not projecting what is happening. And what we are focusing on is the dynamic modeling that we have that shows us what is happening based on our data. And actually, death data is not something that is easily projected into a model because scenarios can be very different. If you look at ours, for example, where we have a lot of long-term care home outbreaks, we have a high proportion of deaths in those outbreaks. That doesn't reflect the general transmission of this virus in our community. So I just don't understand. I don't believe that projections or estimations that are based on models are particularly helpful. What we are looking at is what we are dealing with. And what we've told you and what we will present again and continue to share the details of is exactly what we're tracking and how we're moving, what we're seeing on a day-to-day basis, and what the possibilities are compared to what we've seen in other places in the world. And it's not that different from what they've presented. I just, that's the modeling that we're using. We're being open and transparent with it. And we can see that the things that people are doing here in BC are making a difference. And that's the important thing.
Keith Baldry, Global News. Go ahead.
Hi, Dr. Henry. Wonder if you could expand. You mentioned you've got some data that suggests people are indeed changing their behavior and following your recommendations. Just if you've got some examples of that. And also, Minister Dix, if you could explain further, the $10 million, is that are we about to see someone, instead of working at 3 different facilities, they're going to put 8-hour shifts in one facility, 40 hours a week, and that's how that money is sort of accounted for?
Yeah, and so in terms of the behavioral data, we'll present some of that next week, but some of it came out publicly on Google, for example, where they showed using anonymized big data of cell phone use or cell phone tracking. They could tell how much people were going to things like restaurants and bars and how much that has decreased. The social interactions have decreased in different parts of the country and around the world, so part of it's based on that.
So that's an estimate of cost, and we wanted to present that today to give you a sense of what's involved. Different people working under different collective agreements in different care homes. What we want to do is to ensure that workers don't lose out. In other words, that they're lifted during the period of the order to this higher level, and that we would, of course, support that as well. And so there are differing wages. So people who are earning a different amount in 2 different care homes don't have to choose based on the amount they're earning, but can be chosen and assigned and worked the same amount, earn essentially the same amount regardless of the decision they make. So that's the reason why there's extra costs. It's in some cases salary increases. In some cases it'll be increasing in hours, but it's principally addressing salary differentials.
Next question comes from Dirk Meisner, Canadian Press.
Hi, Dr. Henry. I think you said one of the 21 long-term care homes now has no longer has COVID-19. I'm wondering how you go about declaring that or finding that or declaring that, and also does that mean that people who have family members in there can go and visit a place once it's cleared?
How we do that, we have an outbreak protocol that we use in long-term care. So it has to do with having no new cases for 2 incubation periods. So we've actually had 4 long-term care outbreaks that have been declared over because there have been no additional cases in those care homes. So that's a routine protocol that we use for outbreaks every year in long-term care. In terms of the visiting policies, the sad thing, no, we are restricting visiting in all long-term care homes in BC right now, and that is because we know that a non-essential visit, and I shouldn't call it non-essential because we know how important it is for our family members in long-term care to receive visits from family and from friends and from supporters, but we know that's right now a risk when we have COVID-19 in the community. So all visits are restricted in all long-term care homes right now across the province because of the pandemic.
Next question is from Farhan Mohammed, Daily Hive.
Good afternoon. With the orders against non-essential travel heading into the long weekend and also looking to the future, are there plans in place for any sort of increased enforcement, whether through police roadside checkpoints or things like that, that are really going to prevent people from leaving town or heading to other neighborhoods outside of their immediate communities?
No, we have not taken that approach in British Columbia, and we don't intend to. And in most cases in Canada, we're not using an enforcement approach. It's much more about supporting people to do the right thing, telling them what the right thing is, making sure they have the means to do the right thing. And as we have seen repeatedly, people do follow our advice around that. And so I expect that people will be taking that advice as well this weekend. And there will, of course, be the regular policing and public safety people doing their thing. So making sure that that all of the other important measures are in place in our communities around long weekends. But we do not have specific enforcement around people traveling.
Next, we have Tyler Olson, Abbotsford News.
Hi, Dr. Henry. I've heard significant numbers of construction workers who continue to carpool over longer distances to work site. I think in some cases the employers object, but they don't seem to have the ability to curtail this. What can be done to deter such carpooling or enforcement of the social distancing orders on roads?
Yeah, good question. I don't believe we need to go out there and ensure that every car or every person walking next to each other is their part of the same household or part of the same family. It is, again, one of those things where we trust people to do the right thing. And we know that the vast majority of people do that because we all have a part in this. And it is our own families and our own communities that are going to suffer if we bring it into our community. So we have to take reasonable measures. We have to make sure that people have the means to do what we've asked them to do. We've put in those restrictions. If there are concerns in workplaces, WorkSafe BC has been working with many of them to ensure that the right precautions are in place. And we continue to need to do that.
Next question is Richard Sussman, Global News.
To Dr. Henry or Minister Dix, we're working on a story tonight about being able to get the N95 respiratory masks, and that one of our reporters was able to get them within 72 hours locally. And the question is, why has the province not gone to all the local sources in the province to get the masks before going elsewhere to get them? Why can people still order these N95 masks?
So N95s are what we call respirators. They are a specific type of filtering face piece. So it filters 95% of particles above 5 microns. And so there are a number of them available. There are many different types. And the medical variety that we need has to be fluid resistant and a few other criteria. So there are many types of N95 particulate respirators that you can buy in hardware stores, for example, that may not meet the criteria that we need in healthcare. So we are sourcing in large numbers from various parts of the world because we know that they meet the standards that we need in the healthcare sector. If there's, I know there's still small amounts available of different types of respirators that may not be appropriate for healthcare, to be honest. So.
We took a look. I think what Dr. Henry said is that not all PPE is created equal, and beyond certification, respiratory protection requires fit testing to ensure proper protection. And the model that I think the journalist used, and I may have the wrong journalist, Richard, but and that they're demonstrating doesn't meet the minimum fit test requirements. The masks that, in this case, it appears are large and with no metal nose piece to form the upper nose, no ability to fit our staff or achieve a successful fit test. During SARS, in fact, a large purchase of that particular brand was made, and even when we ran low on N95s, we couldn't deploy them. So I think what's key to remember is that it's not about quantity and speed of delivery, it's about quality and safety, and that is what we're doing. And I can tell you, at the federal level, at the provincial level, enormous numbers of contributors are working on this question of ensuring that healthcare workers have access to the protective equipment they need. And we need protective equipment in the millions, not in the tens, and we need all that protective equipment to meet the safety tests of and the protection tests that we require. And so everything we're bringing in is being tested now, and that's why it's not being brought in, arrive, and deploy. It's being brought in, it's being tested and deployed because it's safety first.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question today comes from Dominique Lévesque, CBC Radio-Canada.
Merci. Bonjour en français pour le ministre Dix.
Oui.
Oui, pouvez-vous expliquer en français ce qui est nouveau pour les travailleurs de la santé dans les centres de soins?
Effectivement, nous savons que les résidences des foyers de soins de longue durée ainsi que ceux dans les établissements de l'aide à la vie autonome sont très vulnérables. On l'a vu dans les résultats, dans les statistiques, dans les décès qu'on annonce ici, surtout, y compris aujourd'hui. L'une des choses les plus importantes, c'est que nous puissions faire pour les protéger et ceux qui en prennent soin, et de permettre aux travailleurs de fournir des services à un seul endroit, ce qui réduit le risque de transmission entre les installations en utilisant les ordonnances en vertu des lois sur les programmes de santé publique et d'urgence. Nous avons développé une nouvelle convention collective qui garantit que tous les travailleurs, dans les autorités sanitaires, les organisations à but non lucratif et privées, reçoivent un salaire équitable et une stabilité d'horaire afin qu'ils puissent travailler sur un seul site sans difficulté financière ni interruption des soins aux patients. C'est ça la réponse. Merci beaucoup. Thank you very much.
Thank you.
Dr. Henry, we'll see you on Saturday.
Have a great day off.